An appendectomy is a very common operation that many people might need. It is a surgery to remove the appendix. The appendix is a small, finger-shaped pouch that sticks out from your large intestine, which is part of your gut. We are not exactly sure what the appendix does, but we know that you can live perfectly well without it. Sometimes, this little pouch can get blocked and then become swollen and sore. This condition is called appendicitis. It can cause a bad tummy ache, make you feel sick, and give you a high temperature. It's a bit like a tiny balloon inside you getting bigger and bigger, which can be quite painful. If appendicitis is not treated, it can get very serious. The swollen appendix can burst, which means it pops open. This can spread germs and infection inside your tummy, which can make you very ill. That is why it is so important to see a doctor if you have a really bad tummy ache that keeps getting worse. To stop this from happening, doctors need to perform an appendectomy. This surgery removes the appendix before it has a chance to burst. It is a procedure that doctors have been doing for a very long time, and it helps people get better quickly and safely. The surgery itself is usually done using a special method called keyhole surgery. This means the surgeon makes a few tiny cuts in the tummy instead of one big one. They use a special camera and long, thin tools to see inside and carefully remove the appendix. This way of doing the operation is great because it means the patient has smaller scars and can usually recover much faster. It's a clever way to fix the problem without causing too much disruption to the body. The goal is always to help the patient feel better as soon as possible, with the least amount of discomfort. Now, imagine making this already safe surgery even safer and more efficient. This is where exciting new technology comes in to help our amazing doctors. We are starting to see how artificial intelligence, or AI, can join the surgical team. AI is like a super smart computer that can learn and help with complex tasks. In the world of medicine, AI is becoming a fantastic partner for doctors, helping them in the operating theater. It is not about replacing doctors, but about giving them extra tools and support to do their job even better, especially for important operations like an appendectomy. In the operating theater of the near future, the team is not just made up of humans. Alongside the skilled surgeon, there is an AI assistant. Think of the surgeon as the captain of the ship. She is the expert in charge, making all the important decisions and using her hands to perform the delicate surgery. She has years of training and experience, and she knows exactly what to do to help the patient. Her focus is entirely on the person on the operating table, ensuring every step is done with care and precision. The surgeon's touch and judgment are what make the operation a success. The AI assistant is like the world's best co-pilot. It is not a robot doing the surgery on its own. Instead, it is a smart system that watches, listens, and helps the surgeon. Its role is to provide information and support. For example, the AI can display the patient's vital signs, like their heart rate and breathing, on a screen in a very clear way. It can highlight any small changes that the human team might not notice right away. The AI is constantly processing huge amounts of data, acting as an extra set of very sharp eyes and ears for the entire surgical team. During the appendectomy, the AI helps in practical ways. As the surgeon uses the camera to look inside the patient's tummy, the AI can analyze the video feed in real time. It might outline the appendix on the screen, making it easier for the surgeon to see. It can also point out important blood vessels nearby that need to be avoided. The AI can even bring up images from the patient's earlier scans, like a CT scan, and overlay them on the live video. This gives the surgeon a kind of X-ray vision, helping her navigate inside the body with more confidence. This teamwork is all about making the surgery safer. The surgeon is always in control, but the AI provides a safety net. For instance, if the patient's blood pressure drops slightly, the AI might give a quiet alert. Or it could remind the team of the next step in the surgical plan, just like a checklist. The human doctor uses her expert judgment to decide what to do with this information. It is a perfect partnership. The surgeon's skill and wisdom combined with the AI's incredible ability to process data and spot patterns. This teamwork makes the operating theater a more controlled and secure place. Before a surgeon ever performs an operation on a real person, they need to practice a lot. Just like a pilot learns to fly in a flight simulator, doctors can now learn to operate in a surgical simulator. These simulators are powered by AI and are incredibly realistic. They create a virtual patient in a computer environment. A doctor in training can hold special tools that feel just like real surgical instruments. They can look at a screen and see a virtual tummy, complete with a virtual appendix that needs to be removed. This allows them to practice every single step of an appendectomy without any risk to a real patient. These AI simulations are very clever. They can create all sorts of different situations. For example, one virtual patient might have an appendix that is in a slightly unusual position. Another might have some scar tissue from a previous operation. The AI can create these challenges so that the doctor learns how to handle them in a safe space. If the trainee makes a mistake, the simulation can show them what went wrong and how to do it better next time. It provides instant feedback, saying things like, "That cut was a little too deep," or "Be careful of the blood vessel on the left." This helps the doctor learn from their mistakes safely. This kind of training is fantastic for building a doctor's skills and confidence. They can practice the same procedure over and over again until it becomes second nature. They can try different techniques and see what works best. This means that by the time they step into a real operating theater, they are already very familiar and comfortable with the surgery. This is not just good for the doctor, it is brilliant for the patients. Patients can feel reassured knowing that their surgeon has practiced many times in a highly realistic virtual world before performing the surgery on them. It helps ensure the highest level of skill. Furthermore, AI simulators can also help experienced surgeons learn new techniques. Medicine is always changing, with new tools and methods being developed all the time. An experienced surgeon can use an AI simulator to learn how to use a new robotic tool or practice a new, less invasive way of performing an appendectomy. This helps all doctors, both new and experienced, to keep their skills up to date. It ensures that patients are always getting the most modern and effective treatments available. AI-powered practice is making our wonderful doctors even better at what they do. The partnership between doctors and AI is creating a future where healthcare is safer and more effective for everyone. In the operating theater, AI acts as a guardian angel, constantly monitoring the patient and providing helpful advice to the surgical team. This support helps to reduce the chance of human error. Even the most skilled doctors are human, and having an AI assistant to double-check things adds an extra layer of safety. This can lead to fewer complications during surgery, which means patients can recover faster and with fewer problems. It's all about making sure every operation is as safe as it can possibly be. Beyond surgery, AI will help doctors learn and grow throughout their careers. By analyzing data from thousands of operations around the world, an AI can identify the best and most successful techniques. It can then share this knowledge with doctors everywhere. A surgeon in a small town could get advice based on the experience of top surgeons in big cities. This means that every patient, no matter where they live, can benefit from the very best medical knowledge. AI helps to spread expertise and make top-quality healthcare available to more people, which is a wonderful thing for us all. This amazing collaboration also gives doctors more time to focus on what they do best, caring for their patients. When an AI can handle some of the data-heavy and repetitive tasks, it frees up the doctor to spend more time talking to patients, understanding their worries, and providing comfort. The human side of medicine is so important. A kind word or a reassuring smile from a doctor can make a huge difference to how a patient feels. AI can handle the numbers and the charts, allowing the doctor to focus on being a compassionate and caring human being. In conclusion, the future of medicine is not about robots replacing doctors. It is about a powerful partnership between human skill and artificial intelligence. By working together, doctors and AI can make surgery like an appendectomy safer, help doctors train and learn more effectively, and improve healthcare for everyone. This teamwork combines the best of both worlds, the wisdom, judgment, and care of a human doctor with the speed, data analysis, and memory of a super smart computer. Together, they are building a healthier and brighter future for all of us.